40% of the world's population will be diagnosed with cancer during their life, 50% if you're male. So we can flip a coin, the two of us right here. I realized very quickly that the cure for cancer is early detection. The problem is we can't find cancer early for everyone because there is no way to screen for cancer ever in the body that's fast, accurate, and affordable.
The cancer healthcare system is broken. Every year, 10 million people will be diagnosed with cancer late, and screening guidelines only exist for half the types of cancer, making early detection rare. This decreases a patient's 5-year survival rate to less than 20%. But what if we could channel the tools of artificial intelligence to make cancer screening faster, more affordable, and more effective? How many lives could we save if cancer treatment went from sick care to preventive care? My guest today is Emi Gal, a software engineer and founder of Ezra, a full-body screening company that uses the power of AI to make MRI scans faster and cheaper.
In the US, we have a shortage of radiologists, especially in MRI. Medical imaging is especially primed for AI because there's a lot of data. We need to support these radiologists with tools in order for them to be faster and in order for them to potentially be more consistently accurate.
Coming up later, we visit a radiology facility that offers the Ezra full-body scans, and one of our directors even gives the scan a try. Stick around as we learn why cancer screening is such a challenge, how we can address the problem through artificial intelligence tools, and make it more affordable for everyone around the world. The only way to solve our biggest problems is to have the audacity to try. Welcome to In the Arena with Evan Baehr. Emi, awesome to be with you today in this conversation. You built this really amazing company that we're going to get the full story on. You're a decade into being this biohacker yourself. Give us the origin story of Ezra and tell us about what the product is today.
Yeah, so I actually came up with the idea for Ezra on my honeymoon. I had been studying the cancer space for about 18 months. And I was on my honeymoon on the beach reading a paper. And the paper was comparing MRIs with CTs, ultrasound, PET, and so on.
Just to clarify, normal people read things like travel and leisure. Or when they say the paper, they mean like the New York Times.
Yes.
You were reading like a peer-reviewed journal article, which you had printed out ahead of time to bring with you on your honeymoon.
Yes, I brought a stack of papers to my honeymoon.
That's not a normal thing.
It probably isn't.
Okay, I love it. You're reading this paper on the beach.
So I'm reading this paper on the beach. It was comparing the sensitivity and specificity of MRI with CT and PET and ultrasound and other types of imaging modalities for the purpose of detecting cancer. And this paper was concluding overwhelmingly that MRI is the best imaging modality for cancer. And so I turned to my wife and I was like, hey, if you could do like a full body MRI, and it was in a reasonable amount of time, reasonably priced, to find cancer everywhere in the body, would you do it? And she said yes, and that's how Ezra was born.
What is our current system for screening and detection, and why are the costs so high that it sounds like very few people are able to afford it?
So unfortunately, there are only 6 organs in which we can screen for cancer right now. You can screen for breast cancer with the mammogram, colon with a colonoscopy, skin cancer with the dermatology check, prostate with a PSA blood test, uterus with a pap smear, and lung cancer with a low-dose chest CT. These 6 organs account for only 50% of all cancers by incident.
What are the major other ones we can't test for right now?
Currently, we cannot test for pancreatic cancer, liver, gallbladder, stomach cancer, kidney cancer, brain tumors, and so on. And the problem is that by the time you learn about them, you're symptomatic. And if you're symptomatic, you're generally at a late stage. And if you're late stage, your survival rate or survival chance is really, really low. And so the biggest problem in cancer right now is that for 50% of all cancers by incidence, we have no way to screen. If you have no way to screen, you're going to find out when you're symptomatic, which will be too late.
So today, what is the Ezra service? How does it work?
So Ezra has created a full body MRI that screens for cancer in 13 organs, all of the organs you cannot currently screen for, that is powered by a number of AIs to reduce the cost of MRI. The way the experience works, you go on Ezra.com, you book a scan, You then visit a partner imaging facility, and we don't own and operate facilities. We partner with ACR-accredited facilities across the country. You get a scan at the facility using our scanning protocol powered by our AIs. The radiologists at the facility read the scan supported by our tools, and then they send the radiology reports to us, and we use AI to convert radiology reports into plain English, into consumer reports that anyone can understand, which we then deliver to our members. And then as a member, you have the option to speak with an Ezra doctor on a video call to kind of go through any questions you might have. And so what we've created is this relatively affordable way to screen for cancer in all of the organs you cannot currently screen for cancer in a way that is fast, accurate, non-invasive, and we have helped hundreds of people find cancer.
It takes a pretty special person to build this kind of crazy company based on a really big idea. Some of this biohacking comes to you pretty naturally. Tell us a little bit about how far out on the spectrum you are on taking your health and your life really seriously.
It started actually when I moved to the US. I'm originally from Romania, and then moved to the US when I was 30. And within 8 months, I went from 160 pounds to like 188. So I gained like almost 30 pounds in 8 months.
The bagels in New York, or?
This is the bagels and the cream cheese in New York, and kind of I guess the change here in this country was like portions were very large, much larger than I was used to in Europe. I think the quality of the produce was not great. I think I started eating a lot of burgers. So I find myself, within 8 months, I gained like 30 pounds. So I was like, what's going on? And so I started tracking things about my body and realized very quickly that I was doing a lot of things incorrectly and that I didn't have enough data to be able to tweak things about my body. So I went on this quest to start tracking things, and now I track 200 biomarkers about my body, monthly, quarterly, and every year. I have a daily log where I track various different things that I should do in order to improve my body.
So with all this data, tell us a little bit about how you picked cancer screening around which you wanted to build this company.
I started Ezra first and foremost because I'm personally at high risk for cancer. My mother also had cancer. Unfortunately, she was diagnosed late and she passed away within about a year from diagnosis. So I've had a cancer scare when I was a child. So I kind of was more aware of the importance of screening than most young people. I was fortunate to start a company in a different space before Ezra that did pretty well. And so when I was deciding what to do next, I became really interested in cancer as a problem. And the more I looked at the data, the more I realized that the cure for cancer is early detection. If you find cancer early, the survival rates are 8 in 10 people. If you find cancer late, the survival rates are 2 in 10 people. So the way to beat cancer is to detect cancer early for everyone. The problem is we can't find cancer early for everyone because there is no way to screen for cancer ever in the body that is fast, accurate, and affordable. And that's what we're solving at Ezra. So the Ezra full body MRI allows us to get a really detailed anatomical and functional view of what's happening inside your body. The challenge with MRI is that MRI is expensive because you're using magnetic resonance of the protons in the water in your body to create internal images of your body. There's a lot of noise in this environment. To reduce the noise, you need to do the scan multiple times because the signal of the organs and so on will always be the same, whereas the noise will always be random. And so if you do something multiple times, you can then average out the noise. Now, if you do the scan multiple times, it adds to scan time, which adds to cost. And so what we do at Ezra is we build AIs to enable us to acquire images much faster, MRI images much faster, and then use AI to reduce the noise and clean the images up. And so last year, we announced that we received FDA clearance for an AI that's enabled us to reduce our scan time by 50%. And reducing scan time reduces costs, and then we pass those cost savings to consumers.
So you get this full body MRI, and a yellow flag or red flag gets raised if there's some abnormal cell growth. Tell me about what could be found in the scan, and then what would be the protocol for following up on that.
Yeah, so there are 3 things that you can find in an Ezra scan, aside from obviously getting peace of mind, hey, nothing going inside your body. The first one is you can find cancer. The second thing is we can find something that is uncertain as to whether it is cancer. It is something to be monitored over time. And what we recommend there is an annual Ezra scan just to see how that thing is progressing. And then the third thing we find is non-cancerous things that can impact your life. Aneurysms, disc herniations, fatty liver disease. And I actually have a friend who got an Ezra scan when we launched it back in 2018. And we found very high fatty liver content can lead to cirrhosis, it can lead to cancer, it can lead to all sorts of health complications. So he went on a quest to resolve that. And fast forward 3 years later, he had no more fatty liver. So the benefit of the Ezra scan is that it can find cancer, which can save your life, but it's also that it can find things that are not cancer that can save your life.
I can imagine getting your scan, I'm reading all these pages, I could just become obsessed, really nervous, false positives. How do you think about intense patients sort of reading too much into it and appropriately calibrating what we as a patient are supposed to consume from your scans?
So I think it is important in full body MRIs to do it properly. And do it properly means making sure that when you're delivering news to consumers, the news is delivered with proper guidance as to what they should be doing about the findings. There's a risk in full body MRIs in that it can lead to incidental findings that can lead to unnecessary follow-ups. And so at Ezra, we have all sorts of processes internally, technology, doctors who advise you as to what you should do about every single finding. And obviously, with screening, when you're screening an asymptomatic population, you have a risk of incidental findings and false positives. Mammograms, for example, have a 90% specificity, which means it has a 10% false positive rate. And so there's always a risk with screening that there's going to be a false positive rate. At Ezra, we're actually working on a study to publish our specificity numbers. So we're calling every single person for whom we found cancer, and we're asking them, was it cancer? Did you do a follow-up diagnostic results? Did you do a biopsy? What were the results? And we haven't published the data yet, but it's looking like we're going to be in line with other accepted screening procedures such as a mammogram, so around 90% specificity rate, which then addresses the biggest concern that people have, which is the kind of false positives and unnecessary follow-ups from.
I want to learn a little bit about in what areas Ezra is really innovating. One of the things you just described so eloquently is the power of MRI, which is this amazing technology. Obviously, that exists. A person with enough money could just go pay for their own full body scan. You are on a mission to make that thing previously available only to the ultra wealthy, available to the masses. And what you're explaining is that one of the ways this happens is through AI technology that you've built that essentially allow for you have 2x the speed, so people are in the machine for half the time. So if it's sort of an hourly rental rate, you've cut the cost down in half.
Correct.
How else is Ezra innovating and bringing this to the masses?
Before Ezra, you could get full body MRIs, but you'd have to pay $10,000 to $20,000. It would be a product for very wealthy people. What we've done at Ezra is we've reduced the cost of a full body MRI to initially $2,000, and last year we announced a $1,000 scan. And ultimately, we think we can get to a 15-minute $500 scan. Now, what's making this possible is 3 AIs that are kind of stacked together in order to reduce our costs so that we can then reduce prices for consumers. The first AI helps make scans faster. This essentially enables us to acquire images twice as fast and then enhance their quality so that radiologists can read them. The second AI helps radiologists be faster. And so we have this AI we call Ezra Assist, which was originally cleared for prostate MRI images, that assists radiologists when they read scans and automates a number of the things that they need to do manually. So measuring the volume of the prostate, or measuring the size of a lesion, or providing annotations around the image, they need to do that manually. With Ezra Prostate AI, that's done automatically for them. So we're making the scan faster using our Ezra Flash AI. We're making the radiology report generation faster using Ezra Prostate AI. And then once we have the radiology report, that needs to be explained to a consumer. So we have Ezra Reporter AI, which takes any radiology report and automatically converts it into plain English so that you actually understand what it means. So Ezra is kind of the only company that's leveraging AI at every step of the screening process. The scan itself is powered by AI, the radiology interpretation is powered by AI, and then the report translation is also powered by AI.
My hunch is that number two, the use case number two, is the most controversial. The first is help the machine have less noise in the visuals. Okay, that seems fine. Number three is like take wonk language and turn it into plain speak. Totally get it. Number two feels most controversial. Let's talk about that a little bit. What do we know? What studies have been done about putting human radiologists against AI?
So there's actually a really interesting research that was done that shows that in prostate MRIs, which is kind of where our AI is currently cleared, only 37% of the time when there's a finding in a prostate MRI scan, do radiologists actually agree amongst themselves. And so I believe that bringing AI in as a second read for every scan will help radiologists in general agree with themselves more, because they'll always have this kind of support tool there to lean upon. I think AI in radiology is there to make everyone better as opposed to replacing radiologists. And I'm starting to see more and more adoption by radiologists, whereas initially when we originally launched Ezra, I was seeing resistance from radiologists, especially when it comes to tools that can assist them.
I'm trying to imagine some other examples where we have a photograph or a video, and we're having this debate about should humans interpret it or should machines interpret it. I'm thinking of things like traffic cameras looking at accidents, NFL replays, even facial recognition technology. In so many areas, to me, it's like, obviously we want the machine to read it. It can be dramatically more precise. There's no opportunity for bias or heuristics in it. It's like the computer should always be favored. I imagine here, though, there's still some lingering thing, like this radiologist has spent 30 years doing this, they're accountable, they have wisdom, they have repeat pattern recognition. Do you wish we would all just say, let the machines do it instead?
I think there's value in radiologists being involved in the process, because an AI can show you the what, and a radiologist can reason upon why the thing is there and kind of provide a little bit more context. So I think human plus AI is a much more powerful tool than human alone or AI alone, especially in something as complex as the human body and radiology and so on. In the US, we have a shortage of radiologists, especially in MRI. I think on average, a radiologist needs to read about 100 and 150 cases, studies per day in the United States, and that number is only going up. We need to support these radiologists with tools in order for them to be faster and in order for them to potentially be more consistently accurate.
And if we already have a shortage, just imagine if another 10, 20, 50 million Americans went and got MRIs, which produce, I think, many thousands of images. So just to keep up with that load, to just get a basic level of processing, our only opportunity really is to leverage AI to work through all those images.
Absolutely. I think AI will become prevalent across every single workflow in healthcare, including and especially medical imaging. Medical imaging is especially primed for AI because there's a lot of data that's digital that can be used to train all of these AIs. And we're doing that at Ezra, and we're seeing a lot of other companies investing in this space.
We traveled to a facility in Hoboken, New Jersey to see one of the Ezra scans in person.
Here for an Ezra scan.
We're at Hackensack Radiology Facility, one of the New Jersey health facilities that offer Ezra scans. And this is Jason, a director at FreeThink, who offered to give the scan a try.
So my grandfather and my grandmother on my mother's side both had cancer. And when my mother did a checkup, they found something that was precancerous. They found it early. And I don't actually know anything about the health history on my father's side. And so it felt like a good opportunity to just do a scan and a check just in case.
So after the scan's in, I'm going to take you upstairs for the MRI.
Okay, great. I hope they find nothing, but if they do find something, I would be grateful that they found it early, which I think is the idea with the Ezra scan. I've never done an MRI scan before, so I'm a little unsure how I'm going to react when they put me into the machine. I know people can get claustrophobic. So I feel excited to do this. Not many people in the world have been able to do this yet, and also a little bit nervous about doing it.
Hackensack Radiology just began offering the 30-minute and hour-long Ezra scans that are made possible through the AI tools. The facility usually averages a couple scans a week.
So once the patient registers at the front desk, we bring them up here, and that's when we do the screening, get them dressed, and then get them ready for their MRI. So come on in. My name's Stephanie. I'll be doing your scan today.
Okay.
So before I get you on the scanner, we're just gonna go through a couple screening questions, make sure you're safe to go in the scanner.
Okay.
So do you have a pacemaker?
I do not.
Okay, any...
Hardware and protocols for Ezra scans are the same as a standard MRI, but technicians do complete additional Ezra training before conducting the scans.
Okay, so when the patient is dressed and screened and cleared to go in, we'll bring him into the MRI suite. We'll go through the whole process, how long it takes, not to move, what to expect, earplugs for the noise. You know, if they have any questions, we'll answer it then. All right, come on this way.
Today, Jason will be getting the 30-minute full-body scan while wearing these Hugh Hefner-style PJs.
It looks pretty comfortable.
In the coming years, Ezra hopes to cut this down to a 15-minute version.
Like I said, it is gonna be pretty noisy. So if you do need me, you're gonna squeeze this ball. So go ahead, give it a little test squeeze because it is a little hard sometimes. There you go.
Got it.
I can also give you some headphones with music.
Yeah, I'll do music.
What do you like? You like classic rock, country?
Definitely not country.
Definitely not. Okay, I get that a lot. So I'm gonna have you lift your head up for those headphones.
MRI stands for magnetic resonance imaging, and it's basically just a really big magnet. They are loud and require that you sit still for long increments of time.
You okay in there?
Yep.
All right.
But how does an MRI work exactly? The human body is 60% water with protons in it, and these protons are like little batteries. When you put the protons in a really strong magnet, like an MRI, they will align to the magnet. And when you spin and rotate the magnet, the protons follow. If you introduce an interference and then remove it, the protons will move and then relax back to the magnet. Monitoring this process with images allows physicians to determine whether an area is muscle and fat or if there's a lesion by comparing these protons in the MRI images.
So once the patient's on the table, we come out here, we're monitoring the patient, making sure they're okay, and we're also just checking the image quality, making sure there's not a lot of motion or anything that needs to be repeated. We don't leave the room ever, we just stay here the whole time.
Breathe in and hold your breath.
So I'll check in on him and then we can finish that. How you doing in there, okay?
Yeah, doing good.
All right, so just make sure you're holding nice and still, nice, easy breathing. You're doing great. We have a few more minutes left, okay?
Okay, sounds good.
After the scan now, I feel good that I got through it. I didn't know how I was gonna handle being in the machine. And now that that part's over, yeah, I guess I'm thinking about, did they find anything? If they did, I hope it's something early and that's treatable. But when I was in there, I was thinking about like how rare it is that somebody gets to do this. That's pretty cool.
Jason's results will be sent to him a few days after the scan. Ezra uses a 1 to 5 number scale to note results that may require monitoring or follow-up appointments. Ezra scans are a preventative approach to cancer treatment through early detection. Emi and his team are using the power of AI to make scans faster and more affordable. But it's exciting to think about what the future can hold if MRIs continue to utilize AI technology. Now, let's return to our in-studio conversation with Emi Gal.
It's interesting to think about, obviously you really bring down the cost of MRIs, but this entire network of sensors, maybe at the level of literally on our bodies, at the least expensive wearable level, but maybe there's something in your building or at your place of work where, okay, you're gonna be able to get the cost of this thing done monthly. I have a lot of these devices. I'm the consumer trying to read and make sense of all this stuff. I email them to my current doctor who says, thanks for sending me all these things. If they all dumped into an AI, so all of a sudden my blood oxygen level or my temperature level is queuing up based on this MRI from a year ago, it really starts to be really exciting how all this stuff could come together.
You've essentially just described what we're working on at Ezra. We started with the full body MRI, and that's kind of our core focus. And then from there, we want to build up on incorporating more data, more sensors, more types of modalities into the Ezra experience in order to give you all of the data you need as a consumer to make better choices about your health.
I know one of the things that you've looked at, I think, is the CDC NIH data about why people die.
Yes.
It's kind of an interesting list. So why do people about your age die, and then why do old people usually die in America today?
So people my age generally die due to non-chronic disease-related issues, such as texting while crossing the street, or kind of car accidents, motor accidents. It's kind of the primary cause of death for young people. People in their kind of older age die because of either heart disease, cancer, or other kind of chronic disease. Heart disease is very preventable if you start when you're really young. There's a research that I think Peter Tia showed, which is that when you take young people who have died in a car accident and you run autopsies on them, you'll find heart disease and kind of plaque being built up from the age of 20. And so as soon as we're like young adults, we start building heart disease. It's just that it doesn't manifest itself until you're mid-50s. And if you're mid-50s, it's kind of pretty hard to start making interventions then. And then the other remaining one is cancer. The challenge with cancer is that you can be fit, vegan, work out every day, and because of the kind of randomness of cancer, you can still get a tumor that grows and ends up killing you. And so the only defense against cancer is to find it early. 10 million people find cancer late every year. For us to find cancer early for those 10 million people, we're gonna have to screen 1 to 200 million people because we're finding cancer in about 10% of our members. To screen 1 to 200 million people, we're at 5,000 now. It's gonna take another 2-3 decades. And so I plan to be working on this until we've solved it.
I'd like to learn a little bit more about root causes, if we know anything about it, about cancer.
I think there are 3 reasons why you can get cancer. You can get cancer for lifestyle choices. Obviously, if you smoke, you're at much higher risk of lung cancer and other types. If you eat a lot of red meat, you're at high risk for colon cancer and other types. But with cancer, you also have polygenic risk scoring. So, you have a genetic mutation that you inherited from your parents or from your family. And then unfortunately, third, cancer is random. Every moment of our lives, we have all of these cells duplicating. And the process of duplication is prone, and so it will lead to random mutations. And if you're unlucky enough, one of those random mutations will lead to an oncogene, which will lead to cancer. That's why prevalence of cancer is much higher over the age of 45, 50, because you've had a lifetime of cell duplication, which has led to an accumulation of genetic mutations that will ultimately lead to cancer.
This approach that you're taking about regular blood work, testing different sorts of interventions of supplements or change in lifestyle, how different is that from how most Americans are approaching their healthcare? How different is that approach from how a primary care physician might meet with and advise a normal patient in America today?
So unfortunately in the US, we're doing sick care, not healthcare. We're treating people when they're sick as opposed to keeping people healthy. In the US, we spend $200 billion on cancer care, most of which is end-of-life care in the last few months of a person's life. Every year, 10 million people will be diagnosed of cancer late. Therefore, their 5-year survival rate is less than 20%. And so when we're talking about changing things in how we do healthcare in the US, I think the key things are reduce heart disease. You can do this by what we just talked about, cholesterol improvements, weight improvements, and so on. You can reduce cancer through screening. So I think if we exercise, eat well, get screened for cancer, we can add a decade to people's average lifespan. And so I believe the way to improve outcomes, the way to reduce costs for both kind of health systems, payers, as well as individuals, is to detect cancer early.
There's a really strange thing in the healthcare industry. It seems like healthcare makes more money when you are more sick for longer periods of time, on more medication, with more people cutting your body staying in super expensive facilities for even more days. Do you agree with that assessment of the industry? And what does that mean for how you design your strategy?
I do think the healthcare industry is currently a bit broken, especially in the United States, but in other countries as well. It is broken because it is sick care, not healthcare, because health systems are more incentivized to treat people as opposed to keeping people healthy. I made a very early decision to go direct to consumer, as opposed to going through what would have been the standard path, partner with hospital systems, partner with payers, and so on. By going direct to consumer, people could vote with their pocket that this is something that they think is interesting and useful and valuable. And now we're moving into the B2B and payer efforts in order to make Ezra more accessible to more people.
I was trying to think of another example where we have such a skewed focus on the rehab versus the prevention, and sort of a silly one that just came to mind would be something like sunscreen. Like, imagine you go into the grocery store and there's a giant wall of aloe and then like one little bottle of sunscreen. It's like, don't sell the aloe, sell the preventative. Help me understand, are there economic incentives? Are there other incentives? Why is it so much on the sort of the rehab piece of this versus the prevention side?
I think a lot of the medical community has been kind of rightfully focused on better and better treatments. Sometimes the most obvious solution is not obvious to the people who are in the system. I kind of had a bit of an advantage being a bit of an outsider to the industry, that I started looking at the cancer problem. I realized very quickly that the data shows that early detection is what can solve the problem. I started looking at why are we not finding cancer early and what are the solutions through which you could find cancer early, and landed on a full body MRI as a solution. So the fact that I came from a background in computer science and mathematics and not a background in healthcare helped me zone in on the solution from a first principle standpoint, as opposed to kind of being too bogged down into the status quo.
They came into this thinking that this was just a scan to learn about the fluke scenario where you might have cancer, but 1 in 2 men will get cancer. So this is not learning about a rarity, this is learning about, are you the coin flip, are you the heads, or are you the tails?
Every year, 10 million people will be diagnosed with cancer late, and only 20% of them will survive because they found it late. If we could find cancer early for all of these 10 million people by having Ezra full body MRIs done by everyone in the world, 80% of them would survive. So every year we could save 6 million lives, again and again and again.
Tell me a little about the business model, how the money flows around. If I were an insurance company, it would seem like I'd way rather pay a few $1,000s for a patient to have the screen and prevent early versus, it sounds like hundreds of thousands or millions in the last years of life. Is this something that insurance is paying for or would pay for?
So Ezra is currently out-of-pocket, direct-to-consumer, cash pay. So as a consumer, you sign up on Ezra.com, you pay us, you get a scan, and then we obviously pay our imaging partners for the scan time and so on. We are speaking with a number of payers about reimbursement, and we're speaking with self-insured employers about covering it. There's a lot of interest because if you can prove that we can detect cancer early without a huge amount of false positives, then payers can then provide better outcomes while reducing costs, which is kind of the ideal scenario. So we have a cancer risk calculator on our website, Ezra.com, where you can answer 30 questions and it tells you what your risk for cancer is across all of the major organs of the body. And so our thesis is that we can take this to payers and say, hey, if someone is at high risk for 3 or more organs that we cover, you should reimburse a full body scan for them. And there's a lot of interest in that direction.
So today, you have your customers, your patients, go into a hospital, get in this giant box that makes a loud noise and is really expensive. What kinds of technologies are coming down the pipeline, maybe you're developing, maybe the ecosystem is developing, that would give us a little picture of the future? Could we be scanning ourselves at home or with our iPhone, or different kinds of imaging that could happen? What are we going to expect?
Yeah, so fast forward a decade, we think you'll keep doing the episodic kind of high-res full body MRIs, but combine those with sensors that you're wearing, sensors that you have in your home, in order to be able to continuously feed an algorithm with your data, which will then enable the algorithm to raise alarms whenever something's wrong. So imagine you're wearing a bra that has like a heat sensor in it. Right now, that heat sensor doesn't really tell you that much about whether you have breast cancer or not. But now imagine that that heat sensor was trained on an AI that also incorporates a breast MRI data. It might now start being able to pick up on red flags on what heat patterns look like when there's abnormal activity in the breast. So those are the types of things we're really excited about. I think they're a decade away in terms of being feasible, but we have an incredible team and we're working on things that will lead to that.
Clearly a problem we're solving. You are a guy set out through gifting and a lot of hard work to prepare your body and mind, and you're reading material on the beach with your honeymoon. Your wife sounds amazing that she would put up with you for that. To be the kind of person to build this particular company, and obviously hundreds of people already have their lives improved, and probably thousands, if not millions. So really excited by what you're building and glad to be with you today. Thanks, Emi.
Thank you. Thanks for having me.